The basic principles of fighting a pandemic or an outbreak is that conflicts do not bode well with the ability to fight a disease. I mean, that is simple stated. So in any area of Africa, countries or region that we experiences conflicts, it will delay the fight against the COVID-19, be it in the ability to roll out vaccines or impose or actually implement basic public health measures. So conflicts are really detrimental to any efforts to fight the pandemic or outbreaks. We saw this in DRC, in North Kivu, where it took us more than 2 years to beat back the Ebola outbreak, even though we had all the good tools in the field. I mean, we had good monoclonal antibodies. We had 2 vaccines that could be used for ring vaccination, but yet because of the conflict there, it took almost 2 years to defeat that the Ebola outbreak. So that is really not good for the ability to rapidly eliminate or fight a pandemic. With respect to South Africa, South Africa has also received vaccines from the COVAX facility, as well as their own initiative, which is the bilateral deals, which I'm not in a position to, I'm not privileged to that information to be able to share with accuracy when South Africa will receive the other doses of vaccines. I think the national program, I think the minister is part of the African Vaccine Acquisition Task Team, should be in a good position to explain that to you. Your third question on the passport is our position is very simple, that any imposition of a vaccination passport will create huge inequities and will further exacerbate them, because we already are in a situation where we don't have vaccines, and it will be extremely unfortunate that countries impose travel requirement of vaccine immunization certificates, whereas the rest of the world has not had the chance to have access to vaccines. It's not because the continent doesn't want to be vaccinated, they just don't have the vaccines. It's not because the continent doesn't have the resources to get to vaccines. There are countries that have the money to get vaccines, but there are no vaccines to be acquired. So if we go ahead and impose travel requirements or travel immunization passports, then we further makes the situation extremely complicated, and that further exacerbates the inequities that we are all trying to fight against. So our position is clear that we cannot at this point impose it would be inappropriate to impose vaccination passports or requirements given where we are in the rollout of vaccination across the continent.